Metastatic breast cancer community has a fantastic legacy of unbelievably engaged patient advocacy. And so there is just really rich engagement with this, multiplex of patient advocacy organizations, engaged patient communities that make it easy to partner and do this work, do this research. We partnered with 4 nonprofit organizations, and we easily could have partnered with 1,000. Like there's just so much opportunity. Breast cancer is also a very heterogeneous disease, right? It affects the very young, it affects the very old. Triple negative breast cancer and hormone receptor positive breast cancer have very different timelines, which make both the therapies, the toxicities of therapies, the disease course, and the clinical meaningfulness of the therapies that the patients are experiencing dramatically different. In hormone receptor positive, for example, patients are often on oral based therapy for over a year before they even start considering things like infusional therapy or more traditional chemotherapy. Whereas in triple negative breast cancer, they're often on multi-agent chemo plus immune checkpoint inhibitor. And even then for a short time before needing to move to second line therapy. And so I think that the it's not just one disease aspect of breast cancer helps enrich the feedback that we get from this community that potentially adds to how this might relate to other patient communities. I will also say that although breast cancer certainly does and can affect men, it is largely a disease of women. And I think that the communication patterns of women are just different. As a result of that, the caregivers of patients living with metastatic breast cancer are a very diverse group. Some of our caregivers were sisters, mothers, daughters, and some of our caregivers were husbands. And I think that in a lot of other diseases, the caregivers are perhaps more traditional groups of people. And so it also created some diversity in our caregiver population, which was an interesting way to consider the caregiver voice in our study.